More controversy over supposed high levels of arsenic in apple juice. A Consumer Report study released yesterday says 10% of fruit juices tested contained arsenic levels higher than the standard set for drinking water. Fox Connecticut's Jen Bernstein has more on this report and some advice for parents. Jen.
Brent, this all came out a few months ago on Dr. Oz's TV show. He presented results of an investigation his team did into arsenic levels in apple juice. Now, Dr. Oz said the study found potentially dangerous levels. The FDA adamantly rebutted the claim that this juice is unsafe, but now we have this Consumer Report study, which is once again fueling the controversy. Dr. Oz sparked the controversy on his show in September.
How can I be standing here in America talking about arsenic in apple juice?
It's a question various consumer groups are also asking as they demand the Food and Drug Administration take a closer look at the issue. A Consumer Report investigation released Wednesday showed 10% of juices they sampled had arsenic levels higher than the standards of drinking water.
I think all the major players in this argument, even the ones that were critical of our earlier studies, have now come to agreement that we have a problem with arsenic in apple juice. The question is now, what are we going to do about it?
The FDA maintains apple juice is safe for kids, but reports out today say they are continuing to look into the issue and are examining their standards.
What this means, we really can't say. They were very low levels, but the kinds of experiences that we've had with arsenic and lead involve much higher levels.
A good piece of advice for parents. While consumer groups and the FDA continue to go back and forth, there's nothing wrong with having a healthy conversation with your kid's pediatrician.
I don't believe that these kind of levels, the levels they found, would harm the health of a human being. But just to be on the safe side, I'd recommend that any parents who are concerned should take their kid to the pediatrician or their primary physician, and if they're really concerned, get levels found that can be measured in the blood or urine.
We are talking about two different types of arsenic, inorganic and organic. Now, the FDA says organic is basically harmless, but inorganic arsenic can be dangerous and toxic over a long period of time. Now, the Consumer Report study found most of the arsenic detected was inorganic. So a lot of back and forth, Brent, different tests, it can be very confusing for parents. The best thing you can do is exactly what that doctor said. Sure. If you're concerned, just talk to your pediatrician.
Yeah, obviously this is not an easy problem to nail down, or you wouldn't have Dr. Oz and the FDA arguing about it. But in the meantime, you can nail it down for yourself with a quick trip to the doctor.
Best advice, yes.
All right. Thank you, Jen.